All right, can you hear me? Can I just get a thumbs up if you can? Great. Welcome everybody. Very nice to have you all. So the purpose of this particular phone call, Zoom call, is to make sure that our labor partners have an opportunity to directly interact with our public health officers, Dr. Matt Willis and Lisa Santora. And so I know that many of you have invited guests to be part of this call, but want you to know that this is going to be very structured to provide the opportunity to our labor partners, and that would be the American Federation of Teachers, CSEA, as well as CTA. And we have set this up so that Dr. Willis and Dr. Santora will have a chance to make just a few opening remarks, and then each of those groups will have about 15 minutes to be able to be in direct dialogue. So if by chance you are not one of the labor partners, I want you to know that you can still put a question in the chat if we have time for questions, which I don't think we will. But just as a reminder, this next Thursday at 9 o'clock, there will be another meeting that will be for the broader community, and will be also available through not FaceTime, I'm forgetting the name of it. Yeah, Facebook, through Facebook. So let me give just a little bit of comment from me. On the 18th of June, just a couple of years ago, guidelines were provided in collaboration with the superintendents, myself as the county superintendent, and our public health partners. Those guidelines are available. If you have not had a chance to look at them, you can find them on the website for the County Office of Education, marinschools.org. So that's number one. Number two, these guidelines are exactly that, guidelines. As we have framed it, it provides opportunity for the schools in our community to be able to open in a fashion that would allow for students to actually attend school 5 days a week. So these provide a lot of flexibility for our community, and we're looking forward to hearing your questions. Dr. Willis and Dr. Santora, let me have you go ahead and start with a few opening comments. Thanks for being with us.
Thank you. Thank you, Mary Jane. And thanks to the Office of Education for convening this conversation. I'm Matt Willis, Public Health Officer. I just wanted to start by offering the context of how we see this conversation unfolding and what our common goals are. I see us all on this call and in this space as being partners in what is essentially the same goal, which is creating a healthy environment and a healthy community. As public health officer, I always try and ground our approach towards public health in the World Health Organization's definition of health. And they define it as a state of physical, mental, and social well-being. So I want to be clear that we don't just think of health as the absence of disease. We think of it in much more holistic terms, and I think that's really important as we navigate this conversation around schools, because obviously from a purely COVID-19 infectious disease control standpoint, what we would be doing was all just being alone in our houses, sheltering and waiting for a vaccine. And that would be the most effective way to prevent any transmission that would occur. Obviously, there's a lot of reasons why that would be unhealthy in other ways when we think about mental and social well-being. And so all of this conversation is on this continuum of subjective decision-making about what do we value and how do we balance risk versus benefit at every stage. We recognize that the space that we share here with Office of Education and you and labor and others with regards to schools relates to what are the most important and essential functions societally around how we manage our children and education. And so I just want to start with the statement that we recognize that this is an important thing to get right on both sides, because there's a lot at stake on both sides. On one side is the pandemic itself and the incidents, and the other side is something as fundamental as how do we educate educate our young people on all of the societal things that go along with the way our children are managed during the day, because of obviously how that connects to the workforce. And we recognize that this is important health both for the children in that setting, for students, but also for staff. And we see that as a sort of a collective ecosystem and environment that we want to nurture and support health for everyone. And so that's, we'll get more into the specific questions, but I just wanted to offer that as context. And I know Lisa might have other things to say in terms of framing. I should also, let me just finish by saying I have three kids in schools. I have an elementary school student, a high school student. And so I feel this, not only professionally, but also it's a personal issue for me.
Lisa, any comments?
Just to say that we have been working with the Office of Education and all of the school districts since the beginning, and even prior to our sheltering in place. We have a very strong partnership with all of our school districts. Part of our bread and butter every year is things like norovirus and E. coli and strep, and we have had systems in place and partnerships with your schools to make sure we can keep our school environment as healthy as possible, keeping parents informed and staff informed, and providing the appropriate interventions. We launched, and we've been working at this since COVID launched, where we work together with the Office of Education and school districts to have our pop-up child care centers, and have learned from that and are moving forward in that learning. And I feel reassured both from my position as Deputy Health Officer as well as a mom. My children went last week to their first day at camp at Glenwood Elementary in partnership with San Rafael City School District and the City of San Rafael, who offer that, where everything we're doing is to make sure that we are creating a healthy and safe environment for both staff and for children in order to move forward through COVID-19. So this is something that we have had partnership before COVID-19 hit us. We've had partnerships since the beginning and are taking lessons learned to create that safe environment. So thank you.
Great. So thank you very much. So I'm going to start with Morgan Agnew. Morgan, if you can unmute yourself. Morgan will be the first person from AFT to be in dialogue. So Morgan, there you are.
Hello,
okay,
can you hear me?
We can hear you. Welcome, Morgan.
Thank you, and apologies for the format. I'm up in the mountains, and my mother is up here, and she's using Zoom to Zoom into somebody's birthday party, so I've been relegated to the landline. So
priorities. Very good.
So I want to start by saying to Dr. Willis and Dr. Santora that you mentioned that you're the public health officer, not the public COVID officer, and I just want to make clear that we all really understand that. We understand that there's a huge number of our students for whom being at home for the next 6 months is a substantially greater risk than COVID would be, and we understand that you're responsible for their health as well. So I just want to make sure that you know that we hear you on that, and that we're not myopic looking just at COVID. I was also very grateful, Dr. Willis, to hear you describe us as partners. And as part of that partnership, I was wondering if you and your office would be willing to open up a line of communication with the labor groups. I understand you're extraordinarily busy, but at current, we don't even have an email address for your office that will be answered, and that makes it very, very difficult to have a partnership. So would you be willing to open up a line of communication directly with our labor groups?
Yeah, I mean, we're working mainly through Mary Jane and the Office of Education. Certainly, I'm amazed that anyone doesn't have my email address, judging from my inbox. But certainly, we obviously want to be responsive to your needs. I think it would just be a matter of trying to do that as efficiently as possible, so that the questions that come kind of represent what's collectively understood by labor to be the most important issues, rather than a lot of individual and sometimes contradictory suggestions and feedback that might come from within labor in the absence of that kind of organization on your end.
Okay, so what I will do is I'll go ahead and send an email to, do you want to give me your email address right now, or do you want me to email Mary Jane Burke and have that be passed on to you so you don't have to say it here publicly on the call?
Which, Mary Jane's giving me a thumbs up. What, on the former or the latter?
She can send it to me. And
okay, all right, Mary Jane will send it out.
Okay, and then I understand that you don't want every single one of our members emailing you daily. We certainly understand that when we don't want to be too much of a sink on your time. But I think it's important that those of us in union leadership have an ability to contact you and share our concerns.
Yeah, and I want to be clear that it's not, I don't mind being contacted. What I think just as for a matter of clarity, if nothing else for everyone, is if the feedback that we get from the health department, to the health department represents sort of a consensus concern or opinion, because obviously what does happen is that I might get one completely contradictory idea or suggestion from one version versus another. And if I think I'm responding to labor as a whole and offering different feedback to, it's more confusing for everyone.
Fair enough. We'll make sure to poll our membership before we send you anything.
Thanks.
And kind of on that note, I don't know how you and your office thought that teachers were going to react to the guidelines you put out. I will tell you that among the teachers I've talked to, the reaction was extraordinarily negative. I heard people describe it to me as, and I'm quoting, a punch to the gut. I had a teacher describe it as an existential threat. And that is not, that is not a criticism of the guidelines as much as it is the manner of communication. I think that to the extent that that response was unanticipated, any of us labor leaders could have told you that was going to happen. So I think that the line of communication is beneficial both ways, because we definitely could have flagged for you how teachers were going to react to those guidelines. I would say that the reaction was so negative that a good portion of my members have actually lost faith in your office as a purveyor of public health information, and that's very frightening and very concerning. Obviously, we need to be allies in this, and it's important that the messages are sent in a way that our members can hear and understand and doesn't provoke a real fight or flight response, which I can tell you that it has, at least from the members I've spoken to, which is quite a few.
Okay, well, just to that point, there is an important distinction between sort of the message and the method with regards to communication. And point well taken in terms of flagging maybe, that this was coming. I think we also need to be aware of the fact that things are, changing so quickly with regards to COVID-19, and what we also hear is criticism around delays. When a decision has been made and there's any delay in offering that communication, there's also, I think, a fairly taken criticism that if we had made a decision based on the public, all the parameters that went into this decision, which is really the best thinking that we have to offer to that particular question, that getting that information out sooner rather than later is also in service to labor and everyone else.
Fair enough. I lost my point there, but I'll come back to it. Actually, now I remember what it is. So speaking of how rapidly things are changing, we don't know what conditions are going to look like in mid-August when schools are actually set to open. Under what conditions would you substantially tighten these guidelines? What would be the case count in Marin County where you would say, I'm sorry, conditions have changed, we can't open?
Yeah, thanks for asking that question, because that's, we're forecasting a week, 2 weeks out here, and a lot of the other decisions we're making. So we recognize that we need to be forecasting for August for the sake of planning in schools, but that does seem like a long ways away in COVID time. And so, I hope it's clear for all of us that a lot of this is outside of our control and our crystal ball in terms of our awareness. And I want to be, crystal clear on that from a point of view of just transparency and humility, which is, I can't say that I know what things will look like in mid-August.
What I'm asking is, hypothetically, and I apologize for interrupting, hypothetically, if in mid-August we had continued to see rising case counts, we had never seen 1 week, let alone 2 weeks of declining case counts as the CDC and California Department of Education guidelines suggest before reopening. If we continue to see rising case counts from here all the way through August, and hospitalizations have gone from 7 to 50, I'm making up numbers, I'm being what are the conditions under which you would say prior guidelines are rescinded, schools cannot reopen for all students? And I understand that you can't predict what those conditions are, but I would hope that you can say, well, here's the threshold. If we're past that, we definitely can't reopen.
Yeah, so here's a couple things we'll be looking at. One is, Well, first of all, we know how to, Maureen was one of the first, I was, one of the first health officers to choose to close schools. And we know how to do that. And that's available to us as a tool. And we learned a lot about how to do that in maybe a way that would be less disruptive the second time around if we had to take that step. That remains available to us. We are inviting people to think more creative on the other side of the spectrum. We know how to close. The question is, how do we invite ourselves to be creative in terms of thinking about how do we actually resume classroom-based learning, first of all. Second is, we're learning a lot about the role of, a lot of this will be driven by the science. We're learning a lot about the children, young people's experience of COVID-19 in itself. If they're infected, there's a lot of evidence now that the risk of infection in younger people, large study, multiple nations just came out last week, 50% evidence of about a 50% lower risk of it becoming infected for people below age 20. And then about only 1 in 5 of those people in that study, which was, tens of thousands across the globe, had symptoms. So less likely to be infected, it seems, and less likely to become symptomatic. We know that people who are more symptomatic tend to transmit the virus more, so maybe less transmissibility from children. So that question, and I'm not going to pretend that that's been answered, but we will have a better answer to that question week by week as more data surfaces.
Okay.
Will be important. Well, that's one piece of it, which is, so what is the role of the school environment with regards to countywide experience of the epidemic? What is the risk to adults in that setting that are shared by children, even if we think that children are relatively safe or safer? Then the other would be, what's happening in the rest of the community? Are we seeing, an overwhelming surge in cases into our hospitals such that we don't have the ICU capacity to manage critically ill people? We don't have the ventilator capacity. The alternative care site that we've established is reaching its capacity. Obviously, these are factors that would lead us to have a much more aggressive, back to a more controlled shelter-in-place policy, which could include closing schools.
Thank you. I apologize for interrupting you again. By my clock, I've got about 5 minutes left, and I want to make sure I get through my list of questions. If I asked you every question my members have sent me, we'd be here for until sometime around noon tomorrow. So I've really tried to pare it down to just the most essential stuff. On the note of we know how to close schools, that's certainly true. What we don't really know how to do well, but we've been working on it very hard, is distance learning. We just had 2 days of professional development at my site that were fantastic. We all, I think, improved dramatically on our ability to conduct distance learning. I think a lot of us have the concern, and I'm not looking for an answer on this, I just want to flag it for you as an issue. A lot of us have the concern that if we knew now that schools would be largely closed for the rest of the semester, we could really devote a lot of attention to getting to be much, much better at distance learning. Whereas if we open schools but then are forced to close them due to outbreaks sometime in, so let's call it September, now we're back to distance learning anyway, but we haven't had the time to really ramp up and do it well, and that's going to have a negative impact on kids' education. So I just wanted to flag that for you, that yes, we know how to close schools. What we don't have a lot of experience with is running them once they're closed. And the more time we have to get ready for that, the better we'll be at it.
Yeah, since you raised that, one comment is that distance learning will play a role in any configuration that we do.
Thank you for saying that publicly. That is not something that I've heard said much out of the offices, so I want to really thank you for saying that publicly. I think that's a really valuable point.
And I'll finish that, which is to say that if there is cases in cohorts, we will shut those cohorts for up to 2 weeks. And that's going to need to be something that's a gap that will need to be filled through distance learning. There may be some children who, because of medical conditions, don't have the opportunity to, or it's maybe their pediatrician may declare that it's not safe for them to return to school, despite all the other steps we're taking. And they will have to have distance learning opportunities. And there may be some staff who, because of medical preconditions, are not also able to come onto campus, and they would be, more available for facilitating.
And I know my CTA colleagues are going to come back to that point as well.
Okay.
So, I'm not a doctor. I don't think anyone else on this call other than you and Dr. Santora is a medical doctor or a doctor of public health. At the same time, you're not a teacher. And I think that both of those pieces of expertise are essential for getting this right and for providing the best quality of education we can. And as I read the guidelines and I listened, and I was on the last webinar we had, I came to the conclusion that there were 3 assumptions that those guidelines were built on that are not accurate. And the first one of those assumptions is, and this is based on a comment you made on a prior Zoom webinar where you said high school students will know they're old, they're mature, they will know to keep socially distant and keep their masks on. And it is not a correct assumption that teenagers follow rules. Our high school students will not, some of them will, but a huge group of our high school students will not follow those rules. As current, we have a rule that you're not allowed to smoke marijuana on campus, and we have a difficult time enforcing that. We have students who go off and share vape pens in the bathroom. So I think we really need to build the guidelines around the assumption that our students will be regularly violating the social distance guidelines. And if that assumption means that schools are not safe to open, then we have to reevaluate whether they're safe to open. But we can't open them with the assumption that the rules will be followed. We have to open them with the assumption that the rules will regularly be violated. The second assumption I think your office is making is that schools will be able to follow these complex procedures with fidelity. And reopening of schools during a pandemic is by far the hardest thing any of us have ever watched our school districts try to do. And most of us have had the experience of watching our school districts fail to do things that are a lot easier than this. So I think that assumption is not correct. I think we have to assume there will be significant lapses. And I'll own up to it on my colleague's side as well, that teachers are not going to be perfect at following it either. We're going to have a rule that we're supposed to clean our classroom between classes, but we get sucked into email or are a little bit ill and have to use the restroom and don't get to it. Those things are going to happen. And that's going to be really exacerbated by the massive funding cuts that our 88 districts are facing. Yes.
Sorry for interrupting. You have 1 minute.
Thank you. So moving on to my last point. My last point is that the last assumption is that the only way that we can serve our students well, and I think you addressed this a bit earlier when you said there will be distance learning, is to fully open for all students all day. There's a lot of ways that we can open partially with some kind of a hybrid model and still really serve our students. That's our wheelhouse. That's what we do. We are very good at finding ways to use our ingenuity and our resourcefulness to reach students under difficult circumstances. So what I would ask is, let us do that. Let us do our jobs. Don't write guidelines with the intention that schools be able to open as fully as possible. Write guidelines with the intention that we are safe, and then let us manage a way to work around those guidelines and still deliver quality education to our students. That's what we do.
Okay. Thank you.
Morgan, thank you. All right.
Thank you.
Stan?
Mary Jane, can I just, because it might help in some of the future conversation too, be clear with Mr. Agnew and others that, one of the differences between these guidelines, so the closing school was framed as an order, and many of the elements of the shelter in place are framed as orders, and that's inherited. The state is offering orders, and then the locals offered orders. One is always free to be more at a lower level, so we're able to be more restrictive than the state, and cities and towns are able to be more restrictive than the county. Schools could be more restrictive also in their own regard. So I just want to be clear that when we offer guidelines and recommendations, any school or any school district is free to institute any strategy that would be more restrictive than what we've offered. And again, it is framed as recommendations. So what's on the table here is the recommendations of public health in terms of what we see as the standard moving forward, and this isn't a question of having to modify something that is legally, that you're legally obligated to do by way of an order.
Okay, great. Thank you. Okay, if we could move now to Stan Bransgrove, the labor representative for CSEA. Stan, you'll have to unmute yourself. Let's see, Um, hmm. Okay, then I'm gonna go Carmen. Hugo, are you on? All right, what I'll do here is then I'm gonna move over to our partners at CTA and we'll swing back to CSEA. And so if I could then pass it to you, Christopher.
Thank you. Can you hear me?
Yep.
Great, thank you. I first of all want to say on behalf of CTA that the comments from Morgan are shared by all CTA in Marin as well. We have 5 different chapter leaders that want to ask questions today and have comments made. But know this, we, the leaders of the labor in this county, we represent the employees, right? Administrators do not represent employees. And so when we ask for direct communication and collaboration with Dr. Willis with your office, as well as with Mary Jane with your office, it's because we represent people and we need to be included more in these conversations, and 15 minutes is simply not sufficient. But with that, I'd like to turn it over to Brianna Padilla.
Hi, I am Brianna Padilla, the Santa Fe Teachers Association bargaining chair, and I would really like to appreciate that you're taking the time to listen to us and hear us, and you will be hearing in the next few questions from our 1,100 members with their concerns with the guidelines that were issued. We know that all students need safe and healthy schools, and unfortunately, your guidelines do not provide enough safety for us to feel confident to return in August. So with that, the first question is around equity. And with equity being an ongoing concern in the county, how are we equitably addressing the needs of our most at-risk students, such as the Latinx population, where we know that the Canal population is disproportionately experiencing high numbers of COVID-19 cases? Other at-risk students include those with special ed services, with health-related IEPs and 504 plans. So we're curious what precautions are being taken to ensure their safety, their peers' safety, and their educators' safety.
Yeah, I think, equity is, for those of us that have been doing public health, the racial parameters and economic parameters around well-being and health have been so clear. From my just experience as a clinician, I worked in the Canal with Marin Community Clinics, and knowing that the stage is set sort of against health for historical reasons in that community, and we see differences in life expectancy really by income and race in Marin County. The reality is that if we're going to sort of use an equity lens to the question around opening versus not opening schools, we know that there have been studies that we did a lot, worked with the Office of Education to make sure that for the distance learning experience that Chromebooks were available to students that may have not had that previously as part of their household experience, and about half of those in some studies weren't even turned on. Despite the fact that we are expecting, a couple months of learning, the tool that was offered people to address the so-called equity issues around learning were actually just not even remotely equitably distributed. So I think one of the parameters that actually fueled the decision to make this announcement was in fact for the sake of equity. And that's an important point. We could talk more about that if we talk about educational equity and distance learning. There's a lot of evidence for that as being really one of the most primary harms of the way we've organized education in the absence of classroom-based learning, both for families that can't afford childcare, dual income families. One of the realities from an infectious disease standpoint, even if we take out the social and equitable, just think about from an infectious disease standpoint, when people don't have opportunities for individual at home classroom, where they're learning at home. So there's 2 days in school, 3 days out of school. What happens on those 3 days where they're not in school is going to be variable depending on the income of that individual. for some families, that child can stay home with a parent who's able to stay home with them and maybe shepherd that experience where they make sure that they're on the technology, they're having that distance learning experience. That's not going to be, that's in my household, my wife might be able to do that, or I might be able to stay home, but that's not going to be the experience in a lot of households. And in fact, what would happen otherwise is groups naturally, and we were seeing this happening, groups are naturally starting to form among parents that needed a way for their children to be safely at home during a day where they're not in school. That becomes a whole nother cohort of mixing that's much less controlled. So we could say we want a cohort of 12 kids in the class from sort of a purist standpoint. But the problem is that if that's 2 days a week, the other 3 days a week, they could be having a lot more mixing, and you end up losing all that sort of infectious disease benefit of that cohort of 12 because they're functionally, in terms of their life experience and their exposures, mixing with a lot more students, and that problem would be inequitably distributed. So people of lower income would have more mixing, and that's another, so just to say, that we have thought through many of the equity implications of these decisions, and I think that's one of the most important drivers of the guidelines that we've offered thus far. In terms of right now, in terms of the canal, I think in some of we are seeing much higher case rates in our Latinx community. It's partly because they have been the sort of the backbone of the workforce since the beginning of the shelter in place. They've been out, and they're bringing the infection back to households that may be densely populated, and we're seeing amplification of transmission within that household. Our approach is the same as that we're taking to any other community: aggressive testing, identifying people as early as possible, making sure they have every opportunity to isolate from their household, offering hotel rooms if necessary, offering income support for people who lose income for that 2 weeks interval where they're not able to be at work, and just working through case by case with a linguistically and culturally, bicultural competency among our contact tracers to address that problem that is intrinsic to the way we've organized, I think, our society in a lot of ways.
Thank you. I'm going to pass it off to another CTA leader, Lai.
Hi, my name is Lai Turn. I'm the outgoing president of the Loxford Corte Madera Association. And Dr. Willis, I truly appreciate you giving voice to that equity piece for our students. I would love to see that equity being extended to equity and voice for teachers. My colleagues and I have not yet been asked to share our expertise and what it takes to ensure continuity in teaching and learning under safe conditions. And so, as Andrew had said, the announcement was a punch to the gut. So we did reach out to our members, and this is what I want to share with the group from our teachers who are seeing the students every day in the classroom. So taking a look at some of the guidelines, maintaining 4 to 6 feet of social distancing between the students, 81% of our teachers have said that they have little to no confidence in being able to do that. Students wearing masks appropriately, 64% little or no confidence that they're going to be able to maintain that. Ensuring that students use their own learning tools only and not sharing, 51% of teachers will find that extremely challenging to be able to enforce. Enforcing bathroom protocols, 72% of our teachers have little to no confidence in being able to do that effectively. And then teaching in a classroom of 25 in the classroom, or maybe even 30 in the classroom, or in some classrooms, it might be more than 30 students in full PPE, and being able to teach effectively, and our students being able to get effective learning in the best condition. 81% of our students, 81% of our teachers have little to no confidence in being able to do their job effectively. So as a parent and an educator, this low level of confidence to implement some of these simple guidelines is very disconcerting and stressful. And I can see how some of our members are really anxious about how the reopening will look like from district to district. So can you share with the group how you factor in teacher expertise and actual classroom practices in guiding the guidelines that have been put forth for students and educators? It seems like it's a plan of convenience instead of a plan of that speaks to teaching and learning under healthy and safe conditions.
Yeah, that's a great. Well, first of all, I don't think we think this is easy. I think we know that this is a challenge to do, and I do think we're going to need this teacher's best thinking and creative input towards how this is implemented at every level. I think the survey of your student, of your teachers, I think is really helpful. That kind of information to know what are people afraid of, what do they think is possible, what's not. And I would just say, so those challenges of what it looks like intrinsically in terms of how do you share a space with students safely in the era of COVID-19 will be present for any configuration of learning that occurs, whether it's 1 day a week, 2 days a week, or 5 days a week. We cannot do without those. So unless you are suggesting a purely distance experience, those will all be challenges we're going to have to solve together.
And I think that our next question is related to your response right now, if you're okay with Anita jumping in next to continue on the same topic here.
Okay.
Thank you.
Hi, thank you for meeting with us today about our concerns. I'm Anita Collison, president of Lagunitas Teachers Association. The safety and well-being for students and staff are never taken lightly by educators, regardless of current conditions. And yet the recommended guidelines released by you last week seem reckless and cavalier. Where's the scientific justification to go from the March shutdown of countywide school sites with 100% remote learning to the current MCOE and public health officer guidelines, stating districts can reopen 5 days a week with cohorts of up to current enrolled class sizes? What has changed, or what do you foresee changing concerning risk factors between March 16th to mid-August?
Well, this is new space for me as a public health officer, and I'm just learning some of the dynamics between labor and administration. I'll just be frank. It seems to me as though what I'm hearing is that labor doesn't want schools open.
I'm sorry, I'm going to have to object to that statement, and that is so insensitive to have said. We've said literally the exact opposite.
Okay, well, and again, this is, if we want dialogue, then it's, I want to.
So I think I'd like to interject really quickly on behalf of CFT. One of the things that we want is that we want schools to be safe places for both faculty, students, and staff. And at this moment, with budget cuts that are happening, coming from the state, and school districts asking us to cut back more and more, we don't understand how that's going to happen. So it is an unsafe work environment.
Okay, well,
this is not places where people can learn and be safe at the same time. Anita, you had another thing to add as well.
Well, I just want to say it's a 180-degree turn from 100% remote learning to now. And the reality is these recommendations are being placed into our districts, and they are putting it out there in the simplest terms: 5 days a week, up to full-size classes. So whether you want to say they're recommendations or not, they're being placed into our laps without our suggestions or input so far in place at all.
Yeah, I guess the specific question was, I guess I'm just going back to my previous response, which is once we have in-classroom learning established as a piece of the solution, where we have 4 walls and a door and children and adults together, and there's a teacher and students, the details around how that occurs and how many days that occurs are secondary to what is intrinsic to making that environment safe. The most important decision is the one to whether or not that is a model at all, right? So one option available to us is to remain distant, right? Is to just continue with the model that we've been using thus far into the end of the school year, and not reopen. Once the decision is made to reopen, and I'm not sure there are any schools in California or the governor or any other that would suggest that we're not reopening. Once the decision to reopen is made, the question becomes how. And I think that's where we need to have really productive dialogue in terms of what are the elements of safe resuming of classroom-based learning where you have children and adults together in the same space teaching. And I think we need to be invited to all of our best thinking in that space. And I'm open to, we have, this is, June 22nd, we're talking about mid-August. There's time, right, to sort of define what those things are. And I'm hoping that we can use that time, productively in terms of designing the best strategy, building upon what we've already learned from pilots that we've determined based on smaller cohorts, where we've already sort of defined what some of the strategies are to do this safely.
Can I jump in, Matt, too, for a second?
Yeah.
And I think I really appreciate where everyone is at and the challenges and the feelings that you have. Where it reminds me a lot of where we were as a county with our employees and our workforce in March, and being identified as essential workers who need to go out into the community and making sure that all of the safety and supports that staff need in order to feel safe and to do their best, that they have them. And I'm just going to be open and honest. It was a process. It really honestly took us 2 to 3 months from March to today even. And there's still learnings each of our sites are having on how to create that safest environment. And I think that was going back to what Matt said earlier, getting this out early, knowing some of the times and seasons of school to be able to start this dialogue at the school site, and recognizing that each school is very different, each school district is different, and to start being able to have those conversations with staff and parents and administrators, start building up what can we be prepared for in August. And I feel everything you're saying reminds me of where we were as a county 3 months ago, and it takes time, it takes open dialogue, it takes really creative problem solving, and we'll get there. It's just, again, it's the start with these conversations, the conversations, again, look at your school site and with your administrators, and that's why we're here today. And it's going to take that time and investment in that creative problem solving. And the other thing
I think that in regards to the maintaining of physical, mental, and social well-being that we started off with, I think we do have 2 more questions from our CTA leaders.
Yeah, Brianna, sorry, we've hit that time. And so we're going to move back to CSEA, and I believe that Kelly Gaffney, are you going to go for the questions?
Yes, I am.
Thanks, Kelly.
Hi, yes. Stan is having issues and Carmen's mic is being off and on. So one of them, the first question was, what is the science / research behind allowing 4 to 5 foot physical distance within classrooms? We're talking about, rolling back, having full classrooms, but we're going to have 4 or 5 foot physical distancing. How is that going to work in a typical classroom? And
yeah, the CDC, I always look to the World Health Organization, CDC, California Department of Public Health in terms of kind of what the rules, the virus kind of writes the rules, and then we try and describe them the best they are and then implement them in our systems. The CDC recommends 6 feet. The CDC's offered guidelines for schools. California Department of Education has offered guidelines. California Department of Public Health has offered guidelines. And in all of them, it's a recommendation of 6 feet where practicable. The terms will be where practicable or where feasible. My concern was, and we've seen it in other counties where as soon as you sort of offer that permission to go beneath that, if you don't offer a lower end, then, you know, sky's the limit. You could end up going 2 feet, 3 feet. And so we chose to sort of offer that 4 feet to say, you know, we really don't suggest going any less than that with regards to how desks are arranged and that kind of thing. And that's based on, you know, the 6 feet is based on, you know, this arc. So it's about where the particles are transmitted out. So especially if our face is covering, about 99% of the particles are just conducted, right, you know, are controlled that way. And then it's a declining curve, you know, with the most falling within a foot, then the next within 2 feet, the next within 3 feet, and so on. When you get to that 4 feet, 5 feet, 6 feet distance, it's much lower risk. So it's sort of this long tail where you still might find some particles in some studies, but it's a much lower amount. And so that's part of that sort of the overall tone of all of this is sort of the risk benefit. And that was the basis for, again, if the CDC had said you required 6 feet, or the Department of Education or the local Department of Public Health in the state, we would have adhered to that. But because it's offered as a recommendation, that we just perpetuate that as a recommendation where feasible.
Matt, can I jump in? This also is supported by our experience with the pop-ups since March. When we did have positive cases, it came from out of the cohort. And then these cohorts, many were childcare. If you can imagine, it was the preschool age groups where social distancing was not feasible or practicable. My favorite word of last week is practicable. We had lots of social interactions in those cohorts. And we only had one child of the cohort, once it came introduced, that only one child did become positive. And that was then again, a non-social distanced environment. And I think that's the other part of us as we're on this journey together with COVID is understanding it. In the beginning of this, it was the devil we didn't know. We knew what flu was, and we talked a lot. If you listen to Matt and I in the beginning in January and February, we're still encouraging people to get their flu shots, and really because we knew that that was at greatest risk for our community in January, February, and March, which it was. We had far higher numbers of hospitalizations and deaths in those early months from flu than we did from COVID. And I think this is where we also are on the journey together of us all learning what COVID means and the risks and benefits of that, and then now making the necessary adaptations as a community to COVID to make sure that we all stay safe. And many of the things with COVID-19 are the same as with flu, where it's the same measures that have protected us from flu that are available to us to protect us from COVID-19. And I think that's, again, we're all learning and we'll continue to adjust and adapt our own responses and recommendations as we learn more. But we are building again on what we've been doing since March with having these pop-up childcare center, which has helped inform these guidance.
Yeah, the other, I think part of that question was what's different now than before. And I just want to offer that, again, there was a lot we didn't know before. The other was when I closed schools was it March? Yeah.
March, no, Friday the 13th in March.
It was a very long time ago. We were seeing exponential growth in cases where our surge capacity, where our hospitals were still didn't have the surge capacity. There were no treatments. There are now 2 treatments available. We didn't have the contact tracers we needed. We didn't have the testing capacity we needed. We were just sort of societally unprepared in so many ways. And we didn't have the knowledge. We didn't know enough. What we were seeing was happening in Italy there. Was much higher mortality rates than we've seen here subsequently, partly because we did have the capacity to manage cases. And so August, we will be much more informed about the nature of the virus itself and how it behaves. And we will have much more capacity to manage what results if we're seeing more transmission. And so those are important factors to take into account.
Kelly, anything else?
Yeah, the other one is what exactly is allowable for middle school and high school cohorts? What is the maximum cohort size in one classroom? I'll just finish this question. Will there be mixing of the students from one classroom to the next, as in like junior high and high school, where they rotate?
Yeah, part of this is, the balance of freedom versus specificity. And the principles, and I hope we can get to a place where in this collective dialogue, what we're doing is sort of articulating what are the public health principles and infectious disease principles, and how do we apply that in the most intelligent way to any given setting. One of the important principles to think about is that we want to limit the overall mixing, because that limits the risk of exposure of any one individual. If you think about it, if you're only interacting with 10 people ever, then your risk of being infected is only related to the risk in that 10. If you're interacting with 100 people ever, then your risk is 10 times higher, because you have 10 times more interactions with different people. The other benefit of a smaller cohort is that that's the unit you would close if you have a case within that group, right? So that's on one end, the benefit. The other is that from a sort of an educational standpoint, and from a curricular standpoint, and a scheduling standpoint, and from a developmental standpoint, taking from that continuum of one individual being sort of the healthiest from an infectious disease standpoint, where do we draw that line? And the point of adolescents not being, be able to necessarily manage the social distancing and the face covering being well taken, we do think that there's a better chance than for elementary school students. And furthermore, for secondary education, the way that the schools are defined and the classrooms are configured is that there is more mixing, as opposed to an elementary school where you really have a single classroom with a single teacher. So for middle and high school students, we want to invite offer the freedom to school administrators and teachers to come up with a configuration that balances that freedom for children to move around from more than one classroom with those other organizers, which is limiting overall risk and recognizing that would be the unit that would need to close potentially, depending on the situation, if there was a case or cases within that group. And so we are intentionally open with regards to the cohort size for secondary, for olders. And that's something we recognize we're going to need to be kind of working through more specifically with school districts and school leaders and teachers. You might imagine, just as an example, if there's 400 freshmen in a class, you could have three classrooms of 100 kids total, where they would be able to mix within that over the school day, which would open up other opportunities, and still limit the mixing across the school.
Okay, can we take that a step further? And now I work for a community college, for Marin Community College. What will that look like for the community college? And then a lot of our buildings now are green, which means none of the windows open. How are we, even in K through 12, are we going to be able to assure that we have proper ventilations, that systems are working, sucking the bad air out, putting good air in, keeping everything afloat? Is there going to be testing that's going to be done to make sure that all the ventilation systems are working properly? And if doors can't be opened, windows can't be opened, like my office, we're sealed up. We're geothermal, so we have no control of fresh air.
Yeah, I would just say generally that the number of individual contingencies by building, by room,
yeah,
are really, again, I think that speaks to the need for just a clear understanding of what are the principles that we're applying to these decisions, and then decision making to actually be ultimately in the hands of those in that setting. We can offer guidance.
Okay.
Obviously, as a principle, ventilation is better than non-ventilation, and it's always been true that we want to make sure that our HVAC systems and other systems are functioning as well as they can be, and changing the filters. I think we can sort of emphasize what we know to be the OSHA standards and those sorts of things that are already in place as being doubly important in this setting, for sure. Lisa, do you have anything to add to that?
No, the only thing I was thinking about, it goes back a step further, is again, just the process of closing cohorts when there's a positive. Again, I think that's one of our conservative approaches towards being aggressive in the management of COVID-19 exposure in our community. And that is one of the protective layers, but it's not what we do with flu. And so I think that's something we're adapting, and we're learning more every single day. And we're entering in the school year with our current public health response would be if there's a positive in any cohort. So it could be the cohort of the 25 elementary students and their teachers, as well as a larger cohort, let's say it's high school students, and the 100 kids who are identified that they've been in AP Bio, gym, et cetera with, we're closing those cohorts down immediately, and then our nurses will complete a contact tracing process. So again, those are tools that we have to really try and ensure and identify as quickly as possible and mitigate any risk of that disease transmission through that environment. And that's our bread and butter staples. But I think it's something for us all to be prepared for that's going to evolve itself across time. We don't know when. Again, if you all remember back into 2009 with H1N1, there was also school closures, which research has showed was not the most effective tool in minimizing the transmission of H1N1 throughout the community. And it was a different experience where we did reopen in 2009, but there was a vaccine more on the horizon. So I think our time course and understanding and how, again, what are going to be the public health measures if we have a positive case in that school community will also be evolving. So just to remember that there's other tools that are in place that are those public health tools to make sure we can identify as quickly as possible. And that's the testing that Dr. Willis mentioned earlier, that we have testing on board that we did not have in March at all. And to be able to have contact tracers, which we have on board right now, which is why you're seeing increases in cases, because we're doing very targeted outreach very quickly to those contacts that we identify as positive. And half of the cases that you see are new every day are because our contact tracers are referring them for testing. And those are tools that are there to keep our school community as well as our community at large to reduce that transmission.
Yeah, we haven't gotten to this, and I know that we're getting to the end of our hour, and this will be an ongoing conversation. I just want to, re-articulate that we are recognize that this is a dialogue that we want to include with, as openly as possible. And so I am, and Lisa, the public health department is available for you, and I know that there's a lot of, important sort of knowledge of the teacher experience in this group that is important to bring forward. Testing hasn't come up a lot, but in my mind is an important complement to a lot of what we've been talking about, because we're doing a lot of what we call now serial testing or universal testing, regardless of symptoms. It used to be only people who were symptoms or people who had known contacts were tested. Now we're seeing the value in testing people just on a regular basis who may be exposed. And that's a way of offering that added measure of reassurance that the environment remains virus-free. And if it's not, we'll know more quickly, even if people don't have symptoms, because we know that symptoms aren't as reliable as an indicator of infection. And so as part of the strategy that we'll be advancing will be a strategy for serial testing for staff and students, depending on the configuration and the risk. That we'll be building into our strategy to sort of offer another measure of reassurance for everyone on campus.
So Matt, with that,
can I ask one more question?
who is this, Kelly?
Kelly, yes.
Yes, but we're right at 2 o'clock, so go fast.
Okay, well, my thing though still is just, it's kind of a continuation of the cohort. So junior high, high school, if they're going to be like, I mean, it's probably might still be unknown, is, as classified teachers, administrators, if we've got 300 kids on campus, are they going to be staying in their cohorts in certain areas? So I will only be with one cohort versus all 3 cohorts coming in to ask for assistance from me or whatever?
That's it. Yeah. I mean, that's the ideal,
Okay.
right? Is that these cohorts, I mean, that you could even imagine just having 3 separate groups within that school environment.
Okay. Okay.
Mhm. But Kelly, the adults are able to move between the cohorts. So that's another piece of the flexibility. And just by way of background, I think that the community college has made the determination, and that's actually, I think, statewide, to actually go only distance learning for this next school year.
Well, that was a K through 12 question too. So,
Yes.
just basically junior high and high school that,
Right.
yeah.
So,
Okay.
okay, so Matt and Lisa, thank you. This
Thanks,
was
everyone.
obviously an easy conversation, and hopefully everyone on the call has great appreciation for the work of our public health officers. They have, to say that they've been working 24/7 since early March would be an understatement. And so I really appreciate everything you've done. Just, this is me to you, that we actually have provided guidelines that allow our schools to open, and to open with class sizes that would allow our children to come back to school on a full-time basis. And obviously there's some work to do, but this will be not the first place in our great state that will be moving forward in this direction. We may be one of the first, but we are definitely not the only. And so if everyone can hold the thought, though, that in fact our schools are going to open. They're going to open. They're going to have students in them. They're going to have staff in them. I'm a believer that the best place for kids and staff is in our schools, and we intend to do everything we can to ensure that that happens. On that note, I know that all of you, hopefully, our schools have teams of people, that safety committees, not sure, different terminology, that are already working to ensure that the schools are ready to move forward. And I think, you know, Dr. Willis made a good point. It doesn't really matter if it's one cohort of 12 or a larger cohort, right, number of days, that, you know, in the end of the story, we've got to figure this out, because the schools of California will be opening and will be serving students, and our job will be to figure out how to do that. And I know we all have the same belief system that relates to how very, very important schools are for our students, their families, and our community. And so,
Mary Jane, there's one thing I forgot to mention that I just can't. As we think creatively about this moving forward, another principle I want to just share is that almost every outbreak we've ever looked at has occurred in, as Lisa said, people very close together indoors. And I think we're not taking full advantage of realizing the opportunity for moving certain things out of doors. So as you are engaged in creative thinking about how we can do this, because that's the work for us over the next couple months together, that's another resource to think about how do we optimize, and it's in the guidelines. Really think creatively how we use that outdoors, because the more we see, the more we learn. We haven't seen surges in cases as much as we expect from the protests. People covering their face when they're outdoors, much, much lower risk. So just wanted to plant that little seed too for your creative thinking.
thanks. Two other opportunities tomorrow at 10. There's a Zoom call with Dr. Santora again. Thank you, Lisa, who will be describing the protocols that are in place when a COVID positive case comes forward. So that's tomorrow at 10. Everybody's welcome to join. And then Thursday at 9 is another larger opportunity for our community to participate. Thank you to everybody for joining. We appreciate it very much. And to everybody who's on vacation, very kind of you to join, and enjoy your summers. Bye.
Thanks.